The chief surgeon threatened her. Then a 4-star general demanded her. The tray hit the floor at precisely 11:47 p.m., and in the brutal hierarchy of Riverside City Hospital's emergency department, that single clumsy moment sealed Margaret Cole's fate as the woman nobody took seriously. Stainless steel clattered across linoleum, gauze pads scattered like confetti, and every head at the nursing station turned with the collective sigh of people who had long ago decided that Maggie Cole was a problem to be tolerated rather than a person to be respected. She was 57 years old with silver-streaked hair escaping a lopsided bun, reading glasses perpetually smudged, oversized scrubs drowning a frame that nobody looked at closely enough to notice was built from something other than softness. She dropped to her knees gathering supplies with trembling hands and burning cheeks, and the particular brand of shame that comes from being invisible until the moment you become an inconvenience. 23 years at this hospital. 23 years of night shifts and thankless tasks, and swallowing her voice until it lived somewhere below her sternum, like a stone she'd learned to breathe around. And still every dropped tray felt like the first one. Still every contemptuous glance from Dr. Raymond Holt landed like a physical blow. That was the thing nobody understood about being the person everyone overlooked. The invisibility didn't protect you from the cruelty. It just meant nobody felt guilty delivering it. If someone dismissed you your whole life and then desperately needed you to save everything, subscribe right now because this forgotten nurse is about to show the world exactly who she's been hiding, and it will shake you to your core. Holt materialized above her the way bad weather materialized, suddenly and without mercy. He was everything Maggie wasn't in this environment, tall and polished, and radiating the specific authority of a man who had never once questioned whether he deserved to take up space. Chief of Emergency Medicine, 12 years running. The kind of surgeon whose reputation preceded him into rooms and whose cruelty followed him out of them. He looked down at Maggie on her knees, and his expression didn't contain anger exactly. It contained something more corrosive than anger. It contained dismissal. The way you looked at a piece of furniture that had failed its basic function. His voice carried across the nursing station with the ease of someone who had never needed to lower it, who had never experienced a consequence for volume or tone or the particular way words could be used as weapons when delivered in front of an audience. Every junior nurse in earshot found something urgent to study. Every resident developed sudden fascination with their clipboards. This was the unspoken curriculum of hospital hierarchies. When Holt targeted someone, you looked away because looking away was survival, and survival was the first lesson this environment taught. Maggie finished collecting the scattered supplies and stood slowly, her left shoulder aching the way it always ached in cold weather, the shrapnel fragment lodged against her scapula, announcing itself the way it had every day for 19 years. She kept her eyes down, kept her expression neutral. She had spent 2 decades perfecting this particular blankness, this deliberate smallness that made her easy to dismiss and therefore easy to overlook. It was armor disguised as weakness, and nobody at Riverside City Hospital had ever looked closely enough to see the difference. She moved to restock the supply cart, and Holt followed, still talking, his words designed to diminish and establish and remind everyone watching exactly where Maggie Cole existed in the order of things. She absorbed it the way she absorbed most things in this hospital, quietly, completely, filing it somewhere deep where it joined the accumulated weight of 2 decades of exactly this. She had chosen this, had chosen the invisibility and the mundane tasks and the deliberate unremarkability, had chosen to be the nurse nobody noticed because being noticed had once cost her everything that mattered, and the scar tissue from that particular wound had never fully healed. The mass casualty call came in at 12:19 a.m. Multi-vehicle collision on the Riverside Bridge, structural failure on the old center span, 17 confirmed vehicles involved, casualties unknown, but the dispatcher's voice had that specific tight quality that meant the number was going to be ugly. The ER transformed in seconds, the controlled tedium of a Tuesday night shift detonating into organized chaos. Holt was suddenly everywhere at once, his cruelty replaced by the clinical brilliance that explained why the hospital protected him despite everything else he was. Maggie moved to her assigned position, which was, as always, the periphery. She restocked, retrieved, transported the invisible machinery that kept the visible work possible. She did not think about what she was capable of. She did not let herself think about that. The casualties arrived in waves. Broken bones, lacerations, a teenager with a traumatic pneumothorax, a woman whose steering wheel had introduced itself to her sternum at 40 miles an hour. The trauma bays filled. The noise built into something physical, a pressure you felt in your teeth. Maggie moved through it with the particular efficiency of someone who had spent years making herself small in chaotic environments, who had learned to navigate crisis without drawing attention. Her hands, which trembled over supply carts, were absolutely steady in the actual work of patient care. Nobody noticed. Nobody ever noticed. The last ambulance arrived at 1:04 a.m., and Maggie was the one who happened to be near the bay doors when the paramedics brought him in. He was a disaster of a human being, covered in bridge debris and river mud and blood that had dried to rust in the cold air. Unconscious, breathing in the specific shallow pattern that made experienced medical personnel lean forward and look harder. No identification. No phone. Nothing that connected him to any life outside this moment. The paramedics gave their report with the clipped efficiency of people who had already moved on to the next crisis in their minds. Found in the water 40 yards from the main impact zone. Possible ejection from vehicle. Vitals were compromised from first contact and declining steadily despite intervention. Holt appeared and assessed him in the 30 seconds that represented his full attention budget for a John Doe who presented as an overdose. The clinical picture was superficially convincing: pinpoint pupils, respiratory depression, the particular muscle laxity that looked like the deep unconsciousness of someone who had taken too much of something. There was river mud obscuring everything, and Holt was a man who saw what he expected to see and expected to see a transient who had been under the influence when the bridge collapsed. It was a reasonable conclusion from a man who dealt in reasonable conclusions made quickly under pressure. It was also completely wrong. Holt gave his orders and moved on, and Maggie was assigned to prep the John Doe for transfer to a low-priority observation ward because the trauma bays were needed for patients worth the real estate. Maggie gripped the gurney and began moving him toward the elevator, and that was when her hands registered something her conscious mind hadn't yet processed. The muscle tone was wrong. Not the laxity of narcotic overdose, but the specific rigidity that came from something else entirely. Something she had only encountered in one context, in environments that didn't appear in any official record, treating casualties from operations that officially never happened. She stopped the gurney, stood very still, let her hands and her eyes do what they'd been trained to do across 15 years of combat medicine before she'd spent 19 years trying to forget all of it. She checked his pupils again, this time with the specific clinical lens of someone who knew exactly what they were looking for. Checked the muscle response in his forearm. Checked the rhythm of his breathing, not just the rate, but the specific pattern of the respiratory effort. Then she turned his wrist over and found the injection site concealed in the crease of his elbow, tiny and precise, the kind of mark left by someone who knew exactly what they were doing and exactly how it would be read by the first emergency physician who glanced at it. Her blood went cold in the specific way blood went cold when the body recognized danger before the mind finished processing it. This wasn't an overdose. This wasn't bridge collapse trauma. This was a weaponized neuromuscular agent with a clinical signature she recognized because she had spent 11 days in a hostile environment watching it kill people while she desperately tried to save them with whatever she could improvise from a downed helicopter's medical kit. She knew this toxin, knew its timeline, knew its mechanism, knew exactly what Holt's standard overdose protocol would do to this man's cardiac function. And she knew that the observation ward he was being sent to would be the last place he'd ever be alive. She turned the gurney around, moved back toward the trauma bays, her movements no longer the apologetic shuffle of the invisible nurse, but something else entirely, something purposeful and direct, and carrying the specific weight of someone who had made harder decisions than this in worse conditions and had learned to live with the cost of both action and inaction. Holt intercepted her before she made it 12 feet. His expression moved through confusion and arrived at fury with impressive speed. The resulting confrontation happened in front of the entire night shift, Holt's voice carrying the full force of his authority and his contempt, Maggie's voice quiet, but completely unmovable, citing clinical observations with a precision that made the residents exchanging glances because that wasn't how Maggie Cole talked. That wasn't the vocabulary of someone who restocked supply carts and made the coffee. Holt's face went through several colors. His final response was the nuclear option that powerful people and institutions reached for when their authority was challenged by someone who was supposed to be powerless. He fired her, called security, had her physically removed with her personal belongings in a cardboard box while the John Doe was redirected to the observation ward, and the standard protocol was ordered, and Maggie stood in the driving rain outside the service entrance with 19 years of hiding unraveling in her chest because she had failed, she had tried, and been removed, and the man on that gurney was dying, and there was nothing left she could do. She stood in the rain and let the despair move through her, and then she heard it. Felt it before she heard it actually, a vibration in the soles of her feet, in her back teeth, in the specific place in her nervous system that had been tuned to that frequency across hundreds of missions in 15 years of night operations. She looked up through the rain. 2 aircraft. No markings, running dark except for tactical indicators, descending toward the hospital's access road with the absolute authority of entities that did not ask permission to land. The rotors she knew. The configuration she knew. She knew exactly who flew aircraft like that at night, without markings in the middle of a civilian emergency. And for the first time in 19 years, standing soaked in the rain outside a hospital that had just discarded her, Margaret Cole stopped hiding from who she was. The aircraft touched down with the controlled aggression of machines operated by people who treated physics as a suggestion rather than a law. Tactical doors opened before the skids fully settled and operators flowed out in the specific pattern Maggie recognized from 100 insertion points across 3 combat theaters. Security element first, perimeter established in seconds, the kind of coordinated movement that turned a civilian street into a controlled zone before most people had processed what they were seeing. Traffic stopped. Bystanders froze. A police cruiser that had been directing accident traffic simply pulled aside because the officer behind the wheel understood instinctively that whatever authority he represented had just been superseded by something operating on an entirely different level. Maggie stood in the rain with her cardboard box and watched it all with the particular stillness of someone whose nervous system had cataloged this exact scenario as familiar rather than threatening. Her heart rate didn't spike. Her breathing didn't change. 2 decades of civilian life had softened many things, but it had not touched the part of her that recognized her own tribe. The second aircraft disgorged a different kind of passenger. He came down the steps rather than fast roping, which meant he was someone who didn't need to prove anything through method of arrival. Tall, broad across the shoulders in the way that came from decades of physical discipline rather than vanity. Dress uniform impeccable despite the weather in the way that senior officers managed through some combination of bearing and refusal to acknowledge that rain applied to them. 4 stars on each shoulder catching the hospital's exterior lights. Maggie counted them automatically the way she'd always counted rank insignia, the habit of 15 years reasserting itself over 19 of suppression. He was scanning the area with the systematic efficiency of a man who had spent a career looking for specific things in chaotic environments. His eyes found her standing by the service entrance, and he stopped scanning, crossed the wet pavement toward her with the directness of someone who had been moving toward this moment for longer than tonight. Maggie looked at his face as he came into the light and felt 19 years collapse like a distance that had never actually existed. Victor Hayes had aged the way combat officers aged. The lines deeper, the hair silver, but the essential architecture of the face unchanged. The same eyes that had looked back at her through a cracked helicopter visor while fire ate the fuselage around them. The same jaw set that meant he had already calculated every option and committed to the one that mattered regardless of cost. She had not seen this man since a classified debrief in a basement room at Fort Bragg 19 years ago, where they had both signed documents promising to forget things that couldn't be forgotten. He stopped 2 feet from her and looked at her the way people looked at each other when the intervening years had been survived rather than lived. His voice came out quieter than his rank suggested it needed to be. "You still can't stay dry in the rain, Cole." Her voice came out steadier than she expected. "You still can't land quietly, General." He took the cardboard box from her arms without asking and handed it to one of his operators without looking away from her face. Then he said the thing that unlocked the next hour. "The man they brought in tonight. John Doe, apparent overdose. He's one of mine, and he's dying, and you're the only person who can save him because you've seen what's been done to him before." Maggie felt the cold that had nothing to do with the rain. "When?" Hayes looked at her steadily. "Horn of Africa. 2004, Mission 7. The words landed like a physical impact. Mission 7 was the operation that ended her military career, the one where the helicopter went down and she spent 19 days alone and came home with shrapnel and nightmares and a classified file so deep it had effectively erased 15 years of service from any record a civilian could access. Mission 7 was the operation where she had first encountered the toxin, where she had watched it kill 4 people before she found the treatment protocol by desperation and improvisation and the specific creative problem-solving that came from having no other options. She's looked at him for 3 seconds, processing the full weight of what he'd just told her. They're using it again. Hayes nodded. Modified. Faster acting. Designed to present as fentanyl overdose. We didn't know Prometheus had the formula until tonight. Prometheus. The name meant nothing to her civilian life, and everything to the part of her that had never fully come home. She had heard that name once, in a briefing that was redacted before she finished reading it, attached to a program that officially didn't exist. Hayes spoke quickly and precisely the way he'd always briefed. No wasted words. Maximum information density. Undercover operative, 3 years deep, built a case against a domestic terror network embedded in military contracting. They burned him 2 days ago. Staged the accident tonight to finish it in a setting where the toxin would be misread. Standard overdose protocol accelerates cardiac failure. She knew. She already knew. She'd known standing over the gurney before Holt had her removed. She'd known and been thrown out into the rain for knowing. How long does he have? Hayes checked his watch. 40 minutes before the toxin reaches irreversible cardiac threshold. Maggie was already moving toward the hospital entrance, Hayes falling into step beside her. She needed pyridostigmine bromide, specific concentration, combined with atropine at a ratio that wasn't in any standard protocol, because the standard protocol was designed for known agents, and this wasn't a known agent. This was a modified version that required the modification to be accounted for in the treatment. She had worked out the protocol in a field environment 19 years ago using improvised equipment and 3 failed attempts on patients who didn't survive the learning curve. She would not have a learning curve tonight. The hospital's automatic doors opened and Hayes operators flowed in ahead of them, establishing presence in the lobby with the quiet efficiency of people who had cleared more hostile environments than a civilian hospital. The staff at the reception desk looked up and went very still. Hayes didn't break stride, his voice carrying the specific register of authority that didn't require volume to fill a room. General Victor Hayes, Joint Special Operations Command. This facility is now operating under federal jurisdiction pending a national security matter. Your administrator will be notified. No staff member will impede our movement. Holt appeared from the trauma bay corridor with the expression of a man whose territory had just been invaded. His eyes moved from the operators to the general to Maggie standing at Hayes' shoulder, and the progression of his expression was remarkable. Confusion, fury, recalibration, something that looked briefly like fear before his ego reasserted control. He pointed at Maggie with the specific energy of someone who needed to re-establish dominance immediately. This woman was removed from this facility 20 minutes ago for insubordination and endangering a patient. She is trespassing, and I want security called. Hayes looked at Holt for exactly 2 seconds. The look contained no anger and no contempt, and was somehow more devastating than either. She's with me. Step aside. Holt opened his mouth. Hayes' voice didn't change volume or temperature, but something in its frequency shifted in a way that made everyone in the lobby very aware of the armed operators standing at measured intervals around the room. I won't repeat myself, Doctor. Holt stepped aside. Not gracefully, but he stepped aside. Maggie didn't look at him as she passed. She was already running treatment calculations in her head, already moving through the protocol, already back in the place she'd spent 19 years trying not to be, the place where everything narrowed to the patient and the problem and the solution that only she could see. Diana Walsh intercepted them in the corridor outside the observation ward, her eyes wide, but her voice controlled. I've been with him since they moved him. I didn't give him the sedation protocol. Something felt wrong, and I stalled. Maggie felt something release in her chest because of course Diana had stalled, because some instincts didn't require 15 years of combat medicine to function, because Diana had been the kind of nurse who paid attention even when the system rewarded looking away. Good, Maggie said. I need you as my hands for this. She pushed open the observation room door and crossed to the bed and began her assessment with the focused efficiency of someone who had performed it in worse conditions, in moving aircraft, in field positions under fire, in the dark with one hand and improvised equipment. Her hands were not trembling. Her hands had never trembled in this context. The trembling was for supply carts and drop trays and the performance of smallness that had kept her safe. This was different. This was the work. She was deep into her assessment when Diana brought the medications she'd requested through Hayes' authorization. Maggie drew the first compound and adjusted the concentration, and something made her look at the man's face now that the worst of the grime had been cleaned away. The face had aged 20 years since she'd last seen it. The jaw was heavier, the lines deep, the boy she remembered barely visible beneath the man he'd become. But the bone structure was the same. The specific set of the brow was the same. She felt the recognition move through her like voltage. She looked at Hayes standing in the doorway. He met her eyes and nodded once. The signal specialist. The 20-year-old kid she'd carried 11 miles through hostile terrain on a broken ankle, whose weight she'd felt in her shoulders for weeks afterward, whose survival she'd thought about on the worst nights for 19 years because he'd been the one she got out when she couldn't get the others out. His name wasn't John Doe. It had never been John Doe. She looked back at him, at the toxin doing its systematic work on his cardiac function, at the monitor showing the dysrhythmia she recognized from a field hospital in the Horn of Africa, at the 40 minutes that had already become 32. She had carried him 11 miles through hostile territory once. She would carry him through this too. She uncapped the syringe. Her hands were absolutely still. Then the door opened behind Hayes, and one of his operators spoke in the clipped register of someone delivering information that required immediate action. "Sir, we have a problem. Lobby security footage shows an unidentified individual accessing the observation ward medication room 6 minutes before we arrived. Someone tampered with his secondary 4-line. They're still in the building." And Reeves' cardiac threshold just moved from 30 minutes to 15. 15 minutes. Maggie processed the number and made 3 simultaneous decisions the way combat medicine had trained her to process multiple critical variables without the luxury of sequential thinking. She pushed the first compound into Reeves' 4-line while speaking over her shoulder to Diana with the clipped precision of someone who had directed medical procedures in moving aircraft under fire. Pyridostigmine, 0.2 milligrams per kilogram, slow push, watch his pressure. Diana's hands moved without hesitation because something in Maggie's voice had activated the part of Diana that existed beneath the trained compliance of someone who had spent her career deferring to authority. This was different authority, the kind that came from knowledge rather than rank. Hayes was already on his tactical radio coordinating a sweep of the floor, but Maggie heard the specific tension in his voice that meant the geometry of the situation was bad. A hospital at night was 17 floors of corridors and stairwells and supply closets and patient rooms, each one a potential position for someone who knew how to use architecture as cover. Carter had a head start and home field advantage in a mission that hadn't changed just because the building was now full of operators. The cardiac monitor shrieked. Reeves' rhythm deteriorated from dangerous to critical in the space of 4 seconds. The tampered 4-line having delivered enough of whatever Carter had added to accelerate the toxin's final phase. Maggie had anticipated tampering, had accounted for it, had already adjusted her protocol before the monitor confirmed what her hands had suspected when she felt the secondary line's flow rate. She moved with controlled urgency, not panic. Urgency had a direction and panic didn't, and she had learned that distinction in environments where confusing the two got people killed. "Atropine, now," she told Diana. 0.54 push. Then we hold and watch for 60 seconds. Diana pushed the medication. Maggie's eyes stayed on the monitor, reading the rhythm the way she'd read instruments in a cockpit, translating data into decisions without the processing delay of someone who had to think about what they were seeing. The seconds stretched. The monitor continued its alarm. Then, at 47 seconds, the rhythm shifted. Not normalized, not safe, but pulled back from the immediate precipice. She had bought him time. Not much, but enough if nothing else went wrong. Something went wrong. The observation ward's lights died. Complete darkness for 3 seconds before emergency backup engaged and flooded the corridor with red emergency lighting that turned everything the color of the inside of a wound. Hayes' voice came through the tactical radio immediately, controlled but carrying the specific weight of a commander who had just watched his operational environment degrade. Carter killed the primary power junction for this floor. He's localizing us. He knows exactly which room we're in. Maggie registered this information and kept her hands moving because Reeves' treatment couldn't pause for operational complications. She had treated casualties during active firefights. She had maintained sterile field in a burning aircraft. The ability to perform medicine while everything around the medicine fell apart was not a skill that atrophied. Diana was pressed against the wall beside the door, her face the specific white of someone whose courage was outrunning their fear for the first time in their life. Maggie spoke to her without looking up from the monitor. Stay on his vitals. Call every change. You're my eyes on the machine while my eyes are on the room. Hayes appeared in the doorway, his operators repositioning in the corridor behind him. We have a problem. Carter has Barbara Kent. He took her from the nursing station in the confusion when the lights went. He's in the medication room at the end of the corridor, and he's put out a demand. His voice tightened almost imperceptibly. He wants you, Cole. Says Kent dies in 5 minutes if you don't come out alone. Maggie looked at Hayes, and Hayes looked at Maggie, and 19 years collapsed into the specific shorthand of people who had operated together in conditions where every second of discussion was a second not spent solving the problem. She read his face, and he read hers, and she understood that he would not send her out there, and she understood equally that he couldn't breach the medication room without Carter executing Kent before the first operator cleared the doorway. She understood all of this and made her decision in the space of a breath. Tell me the medication room layout. Hayes' eyes narrowed fractionally. Cole, tell me the layout, she repeated, her voice carrying the flat certainty of someone who had already solved the problem and needed specific data to execute the solution. His jaw moved. He told her. Maggie administered the third compound in the protocol and told Diana the next dosing sequence and timing with the precision of someone dictating a procedure to a resident. Diana repeated it back without being asked because she was paying the specific attention of someone who understood that what she was being told mattered more than anything she'd been taught in nursing school. Maggie squeezed Diana's shoulder once, brief and communicative, and then she did something that made Hayes move to intercept her. She went to the supply cabinet, not for weapons, she had no weapons, but for what a hospital stocked that someone who understood pharmacology and human physiology could use in ways the supply catalog had never intended. She selected 4 items. Hayes blocked the door. I can't let you walk out there alone. Maggie met his eyes. You can't breach without Kent dying. Your operators take 3 seconds minimum to clear that doorway. He'll use 2 of them. Hayes' face showed the expression of a man who knew he was about to lose an argument to logic he couldn't counter. I have operators who can. Not fast enough, and you know it. She kept her voice level because this wasn't a confrontation, it was a briefing. I'm going to walk down that corridor and knock on that door, and Carter is going to open it, because I'm exactly what he asked for. A 57-year-old nurse in wet scrubs holding a cardboard box. He has never once in his professional life encountered what I actually am. That's the only advantage I need. Hayes looked at her for 3 seconds. Then he stepped aside and she heard something in his exhale that sounded like the specific resignation of a commander who trusted his people enough to let them execute. Keep your radio open, he said. She was already moving. The corridor in emergency lighting was all red shadows and hard angles. Maggie walked it the way she'd walked every dangerous approach in her operational career, steady pace, controlled breathing, eyes processing every variable without letting the processing show in her body language. She cataloged the distance to the medication room door. 31 feet. She cataloged the position of cover if she needed it. Supply cart at 19 feet. She cataloged the items she was carrying and their applications and the specific sequence that would work in the specific layout Hayes had described, the inward opening door, the medication shelving along the left wall, the single overhead light that would be the first thing Carter had secured to control the space. She stopped outside the door and knocked. Not the tentative knock of someone afraid. Not the commanding knock of someone announcing force. The specific knock of someone who had been summoned and was complying. She heard Carter's voice through the door, professional and controlled, the voice of someone who had done this before and had assessed and categorized her as a non-threat before she spoke a word. She heard Barbara Kent's ragged breathing. She heard the precise location of both of them in the room from the acoustic information the door provided, because sound traveled differently in rooms with specific contents and dimensions, and she had spent 15 years learning to read environments through every available sense. "Open the door and come in slowly," Carter said. "Hands visible." Maggie opened the door and came in slowly with her hands visible, because that was exactly right, and she needed him certain and positioned and completely confident for the next 4 seconds. Carter was good. She registered that immediately and filed it without letting it change anything. He had Kent positioned as a shield, his weapon at a precise angle that made a targeting shot impossible for anyone in the corridor behind Maggie. He had his back to the medication shelving, which eliminated the approach from behind. He had the overhead light positioned to illuminate the doorway and keep his own face in relative shadow. He had done everything correctly for a situation involving a conventional threat. His eyes swept Maggie once, and she watched his risk assessment complete and file her as controlled, and she used the exact moment his attention shifted fractionally to Kent to move. Not toward him, toward the medication shelf to her right. The one Hayes layout description had told her held the pressurized oxygen canisters at precisely shoulder height. She swept 2 of them off the shelf with her forearm in a single motion that created a falling, clattering explosion of noise and movement in his peripheral vision. Carter's weapon tracked the noise for 1.5 seconds. Maggie used one of them. The isopropyl alcohol from the bottle in her left hand went into his eyes from 4 feet away, and Carter's weapon discharged into the ceiling as his system processed sudden chemical blinding and involuntary tearing. The wound care spray in her right hand followed immediately into the same target, the pressurized stream compounding the sensory overwhelm. She was already inside his weapon arm, her left hand controlling the gun hand using the joint manipulation technique she'd been taught by a special operations instructor in 1994 and had practiced every year since in the privacy of her apartment because old training died harder than people thought. Kent dropped away from him instinctively. The weapon came free. Maggie stepped back, and Hayes operators came through the door in the specific, organized rush of people who had been waiting for exactly this moment, and Carter went to the floor under 3 of them before he'd fully processed what had happened. Barbara Kent was shaking against the wall, unhurt but thoroughly undone. Maggie checked her with quick professional hands, pulse and pupils, and the assessment of someone who needed 30 seconds to confirm a person was intact. Kent looked at her with the specific expression of someone whose entire understanding of another person had just been reconstructed from the ground up. "Who are you?" Maggie handed the weapon to Hayes' operator and straightened her scrubs and said the thing she hadn't said out loud in 19 years. "Chief Warrant Officer Margaret Cole. Night Stalkers. Retired." She walked back to Reeves' room because the treatment protocol had a 4th compound, and Diana was alone with the monitor, and the clock didn't stop for operational successes. Reeves' cardiac rhythm had stabilized in her absence, Diana's precise execution of the protocol holding the line. Maggie administered the final compound and stood watching the monitor cycle through the next 10 minutes while Hayes stood in the doorway, and neither of them spoke because some silences were complete enough to not require filling. At the 11-minute mark, the monitor showed sinus rhythm. Damaged, compromised, requiring real cardiac follow-up, but fundamentally his own heart beating in its own pattern again. Diana let out a breath that seemed to have been held since the lights went out. Maggie watched the monitor and felt the specific exhaustion that came after the specific focus burned away, the feeling she'd felt after every mission that had gone right, the strange hollow peace of having done the thing and survived the doing. Reeves' hand moved. His fingers found her wrist the way drowning people found solid things, by instinct rather than intention. His eyes didn't open yet, but his grip said everything about the part of him that knew, even unconscious, that he was still alive because someone had refused to let him not be. Reeves opened his eyes at 3:47 a.m., and the first thing he saw was the ceiling of a hospital observation room, painted red by emergency lighting that nobody had reset because the night had moved too fast for administrative details. The second thing he saw was Maggie sitting beside his bed with the specific posture of someone who had been watching a monitor for 2 hours and had decided that was the most important job in the building. His mouth tried to form words and produce something that wasn't language yet, the specific struggle of a mind reassembling itself from the chemical wreckage of a weaponized toxin. Maggie leaned forward and spoke quietly because she understood from 19 years of treating post-mission casualties that the first moments of consciousness after trauma required anchoring, not information. You're at Riverside City Hospital. You're stable. The toxin has been treated. You're safe. His eyes moved to her face, and she watched the recognition happen the way she'd watched the cardiac rhythm normalize, gradually and then completely. His hand found her wrist again. The same grip as before, but deliberate now rather than instinctive. He said her name. Not Nurse Cole. Not ma'am. Her name. The way someone said a name they'd carried for 19 years like a debt they'd never found the creditor to repay. His voice was wrecked from the toxin's effect on his respiratory muscles, but the weight behind it was intact. She sat with it for a moment because some things deserved a moment before the operational world reclaimed them. Then Hayes appeared in the doorway, and the moment passed into the category of things that would be properly addressed when the work was finished. Reeves looked at Hayes with the eyes of a man who had spent 3 years undercover and was recalibrating to a reality where his actual identity was permitted to exist again. Hayes' expression contained the complex mathematics of a commanding officer who had sent a man into deep cover and received him back broken but breathing. His voice was rough at the edges. "We've got everything," he said. "The entire Prometheus network. What you transmitted before they burned you was enough. Federal warrants are executing right now across 11 states. It's done." Reeves closed his eyes, and Maggie watched his chest rise and fall and thought about the 20-year-old kid she'd carried 11 miles and the 39-year-old man who had carried a 3-year mission into the most dangerous territory she could imagine, which was not a combat zone, but the interior of a conspiracy that had embedded itself into American military infrastructure like a disease that wore the host's face. The arrests happened fast. Federal agents had been staged and waiting for Hayes' confirmation signal, and by 4 a.m. the news was beginning to break in the fragmented way major stories broke in the middle of the night. Incomplete information multiplying faster than verification. 17 simultaneous arrests across the country. Prometheus operatives pulled from positions inside defense contracting companies, military procurement offices, infrastructure security firms. 3 sitting defense contractors arrested mid-flight on private jets. The domestic terror network that had spent a decade embedding itself into the systems designed to protect the country dismantled in a single operational night because one undercover officer had survived long enough for one nurse to refuse a direct order. Carter was in federal custody. Hayes' legal team was already building the case that would put him away for multiple counts of attempted murder and domestic terrorism. And Dr. Raymond Holt was sitting in a hospital conference room with 2 federal agents and the specific expression of a man watching every defense he'd prepared dissolve on contact with evidence he hadn't known existed. Maggie learned about Holt's full involvement from Hayes at 4:30 while she was drinking terrible hospital coffee in the corridor outside Reeves' room. The Prometheus connection, the compromised patient outcomes, the instruction he'd received and followed tonight without knowing or caring that the target was federal law enforcement. She absorbed it and felt something complicated move through her that wasn't satisfaction exactly. She had known Holt was wrong about the diagnosis. She had not known he was compromised rather than simply arrogant. The distinction mattered because pure arrogance was its own closed system, but corruption required a door, and someone had opened Holt's door 5 years ago using a dead patient and a covered mistake, and had walked through it every time they needed a medical situation managed. She thought about how many times over how many years Holt's convenient diagnoses might have served interests other than the patient's in his care. She thought about that and felt the specific anger that came from understanding a harm that had been operating invisibly for longer than anyone had noticed. Hayes watched her process it. "You knew something was wrong with him tonight before you knew about Prometheus." She looked at her coffee. "I knew he was wrong about the patient. Whether that was arrogance or instruction, the outcome was the same. A man was going to die." Hayes was quiet for a moment. "That's why I needed you specifically, Cole. Not because you have the toxin protocol. Because you look at what's actually there instead of what you expect to see." She didn't respond to that because some observations didn't require response. Diana Walsh found her at 5 a.m. with the specific energy of someone who had processed an extraordinary night and arrived at a decision on the other side of it. She had spent the hours since Carter's neutralization doing exactly what Maggie had asked her to do, maintaining Reeves' monitoring, executing the follow-up protocol, being the steady hands that kept the work continuous while the operational situation resolved itself around her. She sat beside Maggie in the corridor and was quiet for a moment in the way that people were quiet when they needed to say something they hadn't fully assembled yet. "I've been a nurse for 9 years, Diana said, "and I have never once in 9 years felt like I was actually doing what I became a nurse to do until tonight." Maggie looked at her. Diana met her eyes. "You showed me what it looks like when someone refuses to let the system be more important than the patient. I didn't know that was possible here." "It's possible everywhere," Maggie said. "It just costs something." Diana nodded slowly. "I know that now." Then she said the thing that had been building since she'd watched Maggie walk down the corridor toward Carter's position with 4 items from a supply cabinet and 19 years of training nobody knew she had. "Who were you before this hospital?" Maggie considered the question and the answer and the 19 years of distance between them. "Someone who did this work in places where the stakes were higher and the equipment was worse and the outcomes were never guaranteed." She paused. "Someone who got tired and came home and tried to become invisible." Diana looked at the empty corridor, at the red emergency lighting that nobody had reset, at the hospital that had tried to expel the person who had just saved it from something it didn't fully understand. Did it work? Maggie almost smiled. "No. Some things you can't make invisible no matter how hard you try." Hayes found her at 6 a.m. with the specific directness of a 4-star general who had already decided what he was going to say and was presenting it as information rather than request. "The Congressional Committee convenes in 72 hours. Closed session. We need your testimony about the toxin, about Mission 7, about what you encountered in the Horn of Africa, and what it means that Prometheus had access to the same formula 19 years later." Maggie looked at him. "My record is classified, so deep a background check shows nothing." Hayes nodded. "We're changing that. Partial declassification, enough to establish your credentials and your expertise without compromising ongoing operations. Your Silver Star will be on record. Your service will be on record. Everything they buried to keep Mission 7 quiet, we're bringing it into the light." Maggie sat with this. 19 years of having her service erased from every database a civilian could access. 19 years of being a person with a past she couldn't reference and expertise she couldn't explain, and a career that officially amounted to 23 years of restocking supply carts at a hospital that treated her like furniture. The offer to restore it should have felt like vindication. What it actually felt like was complicated. She went to see Reeves at 7 a.m. when the morning shift was arriving and the hospital was beginning the process of resuming its normal rhythms around the extraordinary events of the night. He was more alert, his voice still rough, but his mind fully present in the way that had been his defining characteristic since she'd first known him as a 20-year-old signals specialist who processed information faster than anyone else in the unit. He watched her come in and sit beside the bed, and he went directly to the thing he'd been carrying since his eyes opened and found her face. "I know what this cost you," he said. "Staying. Refusing Holt. Coming back in." She looked at him. "You don't know the half of it." He held her gaze. "Tell me." So she did. She told him about the 19 years of deliberate invisibility, about choosing unremarkability as armor, about the PTSD that made the ER simultaneously the best and worst environment she could have chosen. She told him about the supply cart trembling and the drop tray and Holt's contempt and the 23 years of absorbing it because small was safe. Reeves listened without interrupting because listening without interrupting was the specific respect of someone who understood that the story needed to be told completely before it could be received properly. When she finished, he was quiet for a long moment. Then he said the thing she hadn't known she needed to hear until she heard it. "You carried me 11 miles on a broken ankle in hostile territory when you could have left me and survived easier. You have spent 19 years believing that cost you everything. What I need you to understand is that everything you thought you lost, your record, your recognition, your right to be seen as who you actually are, we're giving it back. But more than that," he looked at her directly, "every person you treated in 23 years of night shifts at this hospital, every frightened patient you sat with, every impossible moment you held together with quiet hands and no acknowledgement, that was the same person who carried me 11 miles. You didn't stop being who you are. You just stopped being allowed to say it out loud." She felt something release in her chest that had been held since Fort Bragg 19 years ago. Not dramatically, not with tears. The specific, quiet release of a weight that had been carried so long the body had forgotten it was carrying it. The congressional testimony happened 72 hours later in a closed chamber where Maggie sat before a committee that had been briefed enough to understand the significance of what they were hearing. She testified for 3 hours, precise and comprehensive, the clinical details of the toxin and its treatment, the operational context of Mission 7, the significance of Prometheus having access to a formula that had been classified at the highest level for 19 years. The committee members asked their questions, and she answered them with the same steady directness she'd used in Reeves' observation room, the same voice that had told Hayes she only needed 4 seconds and 1 surprise. When it was over, the committee chair said something she hadn't expected. On behalf of this committee and the country whose infrastructure you helped protect, we thank you for your service. All of it. The classified parts we're only now learning about. And the 23 years of night shifts that nobody knew about until last week. Maggie nodded once. Then she went home and slept for 14 hours without a single nightmare about a burning helicopter. 6 months later, Metropolitan General Hospital, which was what Riverside City Hospital had become after a complete administrative restructuring triggered by the federal investigation into Holt's compromised tenure, posted a new position: Director of Patient Safety and Clinical Advocacy. The job description emphasized the kind of nurse who had both medical expertise and the specific courage to challenge institutional inertia when patient safety required it. Maggie read the description and recognized herself in it for the first time in 23 years. She took the job, not because she needed the validation, because the hospital needed someone who understood that the most dangerous thing in any medical environment wasn't a compromised physician or a weaponized toxin or an operative hiding in a medication room. It was a culture that taught people to stay small and silent and to value hierarchy over truth. She was done being small. Hayes called her the week she started the new role. Reeves is requesting you as medical advisor for his recovery program, Hayes said. He says the only person he trusts to tell him the truth about his progress is the person who told the truth about his diagnosis when everyone else looked the other way. Maggie looked out the window of her new office, which had a view of the hospital entrance where 6 months ago she'd stood in the rain with a cardboard box believing she'd failed. She thought about Diana Walsh, who had enrolled in an advanced clinical practice program because one night had shown her what nursing could be when it refused to be limited by what the system expected of it. She thought about Barbara Kent, who had filed a formal culture review request that was now in front of the hospital board. She thought about the 17 Prometheus operatives in federal custody and the 3 families of the patients Holt had quietly mismanaged, and the veteran organizations that had received Reeves' intelligence files and were using them to advocate for better vetting of military contractors. Tell Reeves yes, Maggie said. Tell him I'll be there Tuesday. She hung up and went back to work because the work never stopped, and she was done pretending she didn't know how to do it. 57 years old with shrapnel in her shoulder and reading glasses on a chain, and 19 years of classified service that had finally been partially returned to the public record. She walked through the emergency department on her way to her first staff training session, and the night shift nurses looked up when she passed in a way they had never looked up when she was the invisible woman who restocked supply carts. Not because of the news coverage or the congressional testimony or the 4-star general who called her by her first name, but because something in how she moved had changed. She was no longer performing smallness. She was simply herself, and herself turned out to be someone who filled a room without trying. She stopped at the pediatric ward on her way back, old habit, and found a 7-year-old boy sitting rigid with fear before a procedure he didn't understand. She pulled a piece of hard candy from her pocket and sat beside his bed and began to talk to him in the quiet voice that had never changed regardless of everything else that had. The candy and the voice and the sitting beside rather than standing over. These were the things that had always been true about her regardless of what she was hiding or revealing. The boy's shoulders dropped. His breathing slowed. His hand found hers with the instinct of someone recognizing safety. This was also the work. Always had been. And Margaret Cole, Chief Warrant Officer, Night Stalker, Flight Medic, Director of Patient Safety, was finally done pretending it was less than everything she'd been trained for. If this story just proved that the most powerful person in any room is often the one everyone dismissed, that 57 years of living and surviving and hiding makes you more dangerous, not less, when you finally stop hiding. That kindness and combat capability live in the same soul and always have. That the nurse who drops the tray and the warrior who carries people 11 miles through hostile territory are the same person and always were. That invisibility is armor until the moment it becomes a cage, and the moment you break out of it changes everything. That one person refusing one order can dismantle a conspiracy that threatened an entire nation. Then subscribe right now, because we are just getting started telling stories about the people the world walks past every single day without understanding what it's walking past. About women in their 50s who contain entire wars inside quiet exteriors. About healers who are also fighters and fighters who are also healers in the world that never sees them coming until they've already won. So hit that subscribe button and join everyone who believes that the overlooked are often the most extraordinary, that experience beats arrogance every single time, and that some of the most important battles ever fought happened in hospital corridors by people nobody thought to fear.